Can you talk us through this stage?
Yes, I'm just preparing a tray so that I can use this tray to load it up with the putty, impression putty, so that we can capture a putty key for the patient, which we can use to construct her temporary crowns.
And you're using blue periphery wax on the tray. Is that something you usually do?
No, Susie, she had quite a high smile line and her upper lip was quite tight, so it reduced the amount of thickness of the putty that's coming over the tray. So you're able to reduce that from binding or locking in so much. I used a little bit of peripheral wax there, but this is actually not very often used at all.
Do you concern yourself with the use of latex gloves and what I assume is a polyvinyl siloxane material, or is it not too much of an issue in this sense?
My nurse was the one that's mixing the material, so I didn't really touch it much, so I wasn't concerned.
Here obviously trimming away the excess from the periphery.
This is just so that I can remove the putty key from the tray a little bit easier. Otherwise, like I was saying earlier, a lot of this material was locked into the tray, which usually it's very rarely happens.
And why is it that you like to remove it from the tray instead of keeping it in the tray and just using it in that form?
Yes, because once I remove it out of the tray, I actually cut relocation grooves. So for example, in this case, I was cutting it from canine to canine. So that's one form of reference, which I could when we put back into the mouth, I can use where the canine are lining up for ease of insertion. And often right in the frenum area, I do actually cut a little notch there as well. Just basically something that's easier for me to relocate this jig back. Because otherwise, if it's in the tray, sometimes when you load it up with provisional crown bridge material, you're just not exactly too sure whether you're half a tooth to the left or right, because you sometimes begin to lose that bearing.
Okay. And I see you're relining the putty key with
Yes.
a white material. What is the white material and why are you using it?
This is GC Fit Checker. I can't remember where I learned this from, but I learned it a number of years ago, where often I find when you're only using a putty by itself without this reline, occasionally, particularly for four-arch or aesthetic sort of work, you're still getting certain bubbles or drag marks where where it leaves a lot more access for you to clean up afterwards. So by using this reline, and again for some magical properties, GC Fit Checker just sticks to putty like you wouldn't believe. There's definitely some sort of chemical reactions going on. They never separate. It acts as a really good wash material. It gives you so much more accuracy.
Well, yes, I mean, we can see that on the still photo on the screen now, so that's a really great tip.
Absolutely.
Well, it's time to remove the previous crowns. Was Susie anaesthetised for this step?
No, she was not. These teeth were endodontically treated. And yeah, usually for procedures like these, I don't give patient local anaesthetic unless if they request for it.
And they're okay even with retraction cord?
Yes, I'm fairly gentle with that.
Great, well done. Can you talk us through the process?
Well, whenever we're removing old restorations, I think the greatest amount of care needs to be taken not to damage the underlying tooth structure. So what I've done here, and I think the safest way to do it, is to make a cut from a buccal palatally, through and through cut. So this way, when you lever the crowns from the center, it's very much like opening a sunflower seed. In essence, that you're not putting any pressure onto the tooth structure underneath, but only onto the cement or the luting agent. And
presumably in this case, because the crowns are splintered, you're now going to divide them as well.
That's right, yeah.
And the cuts that we're seeing you make with the high speed now, are they through ceramic and metal, or are they just through?
Yes, right through. For the teeth, until I can see there is a white, usually it's a white colored cement, and I will of course stop at the cement layer. And for between the teeth, that's just going right through.
Now we need to apologise to our cameraman here. We've made his job quite difficult with the operating light that was being used.
Yes, that's right.
We do have plenty of still photos that will show high resolution versions of what is going on, including the palatal surfaces of the teeth. We just weren't about to ask Dr. Lee not to use his operating light and compromise the treatment.
And I deeply appreciate that.
We can see you protecting the airway with gauze. Is that something you do as a matter of course?
Yes, absolutely. Whenever we try to remove bits and pieces off from the patient's mouth, often I think to have a safety gauze is a great idea.
It looks as though the instrument you're using here is a Lacron carver.
Yes.
But why is that your instrument of choice instead of, say, a flat plastic or a spoon excavator?
I think either or is fine. I just got used to using this particular instrument with its width and the strength that you can lever it against. It is quite unusual in Susie's case, although they are PFM restorations, but they were actually bonded using resin cement. So that's why they were actually a lot more difficult to be removed. So although I could remove half of each crown at this stage, but the other half was simply not coming off. So again, with the safety of the teeth in mind, I made subsequent further cuts. And quite often I find with just the vibration of the cutting, that loosens up the resin cement quite a fair bit.
Well, the crowns are off now,
Yes.
and you're using an ultrasonic
Yes.
scaler. What's the purpose here?
Quite often I find there's subgingival calculus, debris, cement, and I just find this is a great opportunity to keep to make things clean before I move on to the crown preparation.